September is National Cholesterol Education Month. Here to tell us more about cholesterol and its effects on the human body is Dr. Vanna Campion, and she is Chief Medical Officer of Terros Health. So Dr. Campion, there's a lot to know about cholesterol, and it's so confusing. There's good cholesterol and bad cholesterol. So let's start with the basics. What is cholesterol, and what is the difference between good and bad cholesterol?
Okay, so it's a great question, Lisa, and cholesterol can be very confusing. Cholesterol is a fatty substance that your body produces that is necessary for a lot of cellular functions. There are two types of cholesterol that we refer to. So one is bad cholesterol, which is the LDL cholesterol. This type of cholesterol is the one that's responsible for fatty buildup in your arteries that can lead to cardiovascular disease and stroke. The second type of cholesterol we refer to as good cholesterol, which is the HDL cholesterol. And this cholesterol is good because it helps to bring the LDL or the bad cholesterol away from your arteries and into the liver where it can be broken down and processed so that it doesn't cause buildup in your heart. So it helps to protect against heart disease and stroke.
So I know when it comes to cholesterol, it's important to know what your number is. So what is the optimal cholesterol number?
For the general population, the optimal LDL or bad cholesterol number is less than 100. The optimal HDL level is greater than 40 for men and greater than 50 for women. And your optimal triglyceride level is less than 150. This is also going to be the case for your total cholesterol. The goal for that would also be less than 150.
Okay. So, and I know cholesterol can lead to some life-threatening conditions, right? So what are some of the dangers of high cholesterol?
I think one of the most dangerous things about high cholesterol is you don't know you have it unless you get blood work to look. So there are no signs or symptoms to point you to having high cholesterol. It is also one of the major risk factors for cardiovascular disease and stroke, which are the number 1 and number 5 killers of adults in the United States.
Are there any myths that we should know about relative to cholesterol?
So one of the biggest ones is that you don't have to worry about your cholesterol until you're older, until you're in your middle ages, right? It's actually not true. There are certain types of familial hypercholesterolemias, so genetic causes of cholesterol. The American Heart Association actually recommends that children be screened for high cholesterol once between the ages of 9 and 11, and then again between the ages of 17 and 21. And the recommendation is that any adult over age 20 gets screened every 4 to 6 years for high cholesterol, regardless of their risk.
So how can people take control of their health, and specifically, how can they maintain a healthy cholesterol level?
Absolutely. So, diet and exercise is extremely important, a part of that equation. If you smoke or you vape, you would want to stop. You would also want to reduce alcohol consumption, reduce your intake of sugar sweetened beverages or refined sugars and processed foods, and increase your intake of healthy fruits and vegetables, as well as 150 minutes per week of moderate intensity exercise. And that will help to raise your HDL cholesterol and lower your LDL.
So finally, how do you go about making an appointment for a cholesterol check at Terrell's Health?
That's easy. You can call our phone number, which is 602-685-6000, and make an appointment with one of our primary care providers. They can do a simple blood test, which will help you to find out what your cholesterol numbers are, and then they can review that and make a specific plan with you to help address your cholesterol and to reduce your cardiovascular risk.
Thank you so much. You gave us a lot to think about today.
Yeah, thank you. I appreciate the opportunity.